I want to second what Patrick has said about Mark. It's been great working with him for these past 3.5 years, and violence was not an area that I knew anything about. I have 25 years in alcohol research, but not so much in violence, and so it's been just a real inspiration for me to be, having worked with the leaders in the field, and especially seeing how much Mark has contributed to the forum over this time. This is the beginning of the 4th year of the forum, and you know, we've covered many things, and the way a forum is designed I really like, because it's not like a consensus panel that the Institute of Medicine does, which most of you are familiar with. This process is different, and the forum meets regularly 3 times a year, and we talk about what the next topic should be, and we talk about that collectively, and you can see in your reading materials the members of the forum and all the various backgrounds that are here. So we've chosen each topic in an organic process. And when we centered on this time to focus on mental illness or mental health and violence, that's come after, you know, meeting together with pretty much a lot of the same people over 3.5 years. And we didn't arrive at this in a very, you know, in a I want to say a flippant way or a surface way, just because the topic sounds like it should be talked about. But this is sort of following on the previous workshops that we've done, which have covered everything from violence against women and children to the cost of violence to the contagion of violence, and then violence in the elderly population or elder abuse. So there have been a number of discussions and ways that we've gotten to know each other and know what our areas of expertise are as we arrived at this particular topic. So we've been meeting and talking about the planning of this for the last several months, and you know, I've been struck with the 2 things that we're centering on here, and that's what we know about mental illness and violence, which is complicated. I'll say that. What we know is complicated, and what we don't know is vast. There's a lot that we still need to learn from research. I was struck at the timeliness of it, too, because when I came home from work last Wednesday, our local Gazette newspaper, it's Montgomery County, which is one of the richest counties in the country. I live in the northern part of it. There was a story called On the Edge on the front page, and it was about 3 particular murders that have happened in the month of January in the northern part of our county. And the headline says, "On the Edge, spate of deadly stabbings raises questions about mental illness, treatment, and the justice system." And I thought that was, you know, well, obviously it was really timely because I was in the midst of planning this workshop with the whole committee, and so I was struck by the fact that it's a local issue for our law enforcement and for our mental health treatment community. I just wanted to read one quote from the chief of the county's Department of Correction and Rehabilitation, where he says, "Of all the issues faced by adult corrections, mental illness is by far the most challenging and difficult." So it's really become an issue for law enforcement, and it's on their minds big time. Also, yesterday here on the Hill, there were some congressional hearings on solitary confinement and the fact that some people are trying to see it gone. And they talked about the fact that it adversely affects, obviously, adolescents and youth. It affects pregnant women, but they also mentioned the mentally ill who are put into solitary confinement. And they talked about the high rates of suicide in prisoners, many of whom were in solitary confinement at some point before the suicide. So it's an issue that's timely, it's here, and I'm going to turn it over to Mark to talk more about what we're going to be doing the next couple days.